I know these malpractice applications can be a little unusual, so um, there's at least two that I recommend you filling out, possibly a third, which is a telehealth application. But for this one, you want to just put the name of your entity, including any DBA. So, like, for example, my entity is Practice Builders LLC, doing business as Build Your Cash-Based Medical Practice. So you would put your entity and the name under which you market to patients. Your mailing address, the date that your entity was established. So whatever date is on your filing documents, the type of entity that you are, either corporation, partnership, individual, other. You can say LLC, S Corp, whatever. The answer, if you're owned by another entity, most likely that's no. Requested coverage in most states, 1 million, 3 million is the norm. Florida is an example that is unique in that they want a lower amount, especially for a weight loss clinic. So if you have any questions about limits of liability, put 1 million, 3 million. And then if they come back to you and ask about limits, you can ask them what they recommend. The insurance broker is always going to have a better understanding. The effective date is going to be the date that you start seeing patients. Ideally, we're not doing anything retroactive. Professional activities and specialties, you are not doing any of these things. You are doing other, and then you're doing medically supervised weight loss. And then here, same thing, medically supervised weight loss. And then number of physicians, so you would have at least one here, and no. And then, it depends on the category of person that you hire. So you're either going to have a probably nurse practitioner, registered nurse, LPN, medical assistant, paramedic, or EMT. Okay. Most likely you're not going to have any of these, and your total staff, it will depend. If they are 1099s, you're going to put them in the independent contractor column. All physicians tend to be 1099. The other positions tend to be employees, but it's however you're contracting them. If they're 1099, you're putting it here. If you're paying them via W-2, you're putting it here. No one has their own malpractice policy. You also want to make sure that you're covering yourself. Okay? You would put in here whichever physician you have as your medical director, doctor, whatever their specialty is, and you can just say, obesity, and then include their CV. Most medical directors, you're going to say no. And no, and then 1 million, 3 million. They're licensed, of course. You're going to have to make sure with your physician, but ideally they have not been investigated, they have not been convicted of a crime, they have not been treated for drug addiction, and they have not had a license revoked. If they meet any of those qualifications, we should probably talk about a different medical director. They do not do chemical peels, acupuncture. Some clinics may be getting into Botox, so you'll have to check off what's appropriate here. We're not doing any laser treatments, liposuction, pain management, etc. Same thing here. No surgeries are happening. No methadone, no detox, no overnight, no nursing home, no anesthesia. No products are being sold. That's for like if there's a specific, like for example, dermatologists have their own product line through compounded pharmacies. You're not doing that. And then we're going to estimate the number of visits for your practice. So it'll be 0 for the last 12 months and then estimate for the next 12 months how many patients we're going to have. And then because you're just getting into business, you have not had coverage previously. You should have a general liability policy already, so you're going to check off yes and include the declaration page for that. If you own another business, you're going to put that here. I believe you're going to say no here. No. Unless, again, you speak with your physician and there's a claims. Sometimes there are claims. It doesn't mean that's a negative. But we will need the insurance history. No. And then I do recommend a risk management policy. It's just a written protocol about patient care. We can talk about that, and if so, we can say yes, and you're responsible. And then you're just going to sign here. And that is the group practice and legal entity application.